What is Medicare? It's health insurance for people 65 and older and for those retirees who lose their coverage, and for those under 65 with certain disabilities. Most disabilities require a 24-month waiting period before enrolling in Medicare. Note, to get Medicare, you must be a U.S. citizen or lawfully present in the U.S., and you must reside in the U.S. for 5 continuous years. What agencies are responsible for Medicare? For enrollment, the Social Security Administration is responsible, so you enroll with Social Security. The Centers for Medicare and Medicaid Services, or CMS, administers the Medicare program. So what are the parts of Medicare? Part A, hospital insurance, covers inpatient hospital stays, skilled nursing facilities for rehabilitation, hospice, and blood in hospital. The cost, you've already paid in full if you or your spouse has worked in the U.S. for 10 years. Part B, medical insurance, doctors, surgeons, all outpatient testing, labs, emergency room, outpatient surgery, home health care, therapy, durable medical equipment, and drugs that are administered by professionals, such as chemotherapy and certain shots. The cost of Part B, most beneficiaries pay $144.60 per month for Part B. Part D, prescription drug coverage. For prescription drugs, you take yourself, unlike Part B drugs, which must be professionally administered. The cost in original Medicare, most pay premiums of from $13 to $35 per month. The cost in Medicare Advantage, in most plans, you pay no premium. Your Medicare options, you can either go and stay in original Medicare or go to Medicare Advantage. Original Medicare is chosen by 70% of beneficiaries, while Medicare Advantage is chosen by 30% of beneficiaries. Original Medicare covers Part A and Part B. You can add Part D and you can add supplemental coverage. Medicare Advantage consists of Part A, Part B, Part D, and extra benefits. Note, Medicare supplement insurance or Medigap policies only work with original Medicare. Comparing original Medicare and Medicare Advantage for doctors and hospital choice. In original Medicare, you can go to any doctor or hospital that takes Medicare anywhere in the U.S. In most cases, you don't need a referral to see a specialist. In Medicare Advantage, in most cases, you'll need to use doctors and other providers who are in the plan's network and service area for non-emergency or non-urgent care. Check with your plan. You can also ask your provider if they participate in any MA plans. You may need to get a referral to see a specialist. Comparing deductibles, coinsurance, and copays. In original Medicare, for Part A, for each inpatient hospitalization, for the first 2 to 60 days, you pay one flat fee of $1,408, a deductible. Skilled nursing care, the first 20 days are free, then you pay $176 per day for days 21 through 100. For Part B covered services, you usually pay 20% of the Medicare approved amount after you meet your annual $198 deductible. There's no yearly limit on what you pay out of pocket unless you have supplemental coverage like Medicare supplement insurance, also known as Medigap. You can get Medigap to pay your remaining out-of-pocket costs, starting with your 20% coinsurance for Part B services, the Part A hospital deductible, and skilled nursing facilities copays. See above. You can use coverage from a former employer, union, or Medicaid. In Medicare Advantage, out-of-pocket costs vary. Different MA plans may have different out-of-pocket costs for the same services. Average copays for common services are to be covered later in this presentation. Note, you cannot buy a Medigap policy if you're enrolled in Medicare Advantage. You may have a plan premium in addition to the monthly Part B premium, but many Illinois MA plans charge no premium and may help pay all or part of your Part B premiums. Most MA plans include drug coverage or Part D at no extra cost. Plans have a yearly limit on your out-of-pocket for Part A and Part B covered services. Once what you paid out of your own pocket reaches the plan's limit, you'll pay nothing for Part A and Part B covered services for the rest of the year. An upcoming slide will cover this. The coverage of Original Medicare versus Medicare Advantage. In Original Medicare, it covers most medically necessary services and supplies in hospitals, doctors, offices, and other healthcare settings. You can join a separate standalone Medicare drug plan for drug coverage from any Medicare-approved Part D insurer. In most cases, you don't have to get a service or supply approved ahead of time for it to be covered. In Medicare Advantage, MA plans must cover all the medically necessary services that Original Medicare covers. Most plans offer extra benefits that Original Medicare doesn't cover, like some vision services, hearing, dental, and more. Drug coverage. Part D is included in most MA plans. Therefore, in most MA plans, you don't need to join a separate Medicare drug plan. It's included. In some cases, you have to get a service or supply approved ahead of time for it to be covered. Travel coverage. Original Medicare generally doesn't cover outside the United States. But many Medicare supplement insurance or Medigap plans cover emergency care outside the U.S. after a $250 deductible. Most insurance companies, though, offer separate trip insurance. Under Medicare Advantage, MA plans generally don't cover care outside the U.S. Again, though, most private insurance companies offer separate trip insurance. Automatic enrollments for Part A and Part B. There is automatic enrollment for people who already receive Social Security benefits or railroad retirement benefits. You'll receive a Welcome to Medicare package mailed 3 months before the month you turn 65, or 3 months before the 25th month of disability benefits if you're disabled. The package includes your Medicare card. Keep it if you wish to accept Part B. To refuse Part B, follow instructions in the Welcome to Medicare package. Carry your card when you're away from home. It no longer includes your Social Security number. Let your doctor, hospital, or other health care provider see your card when you need health care. Some people must take action to enroll in Medicare. For those not automatically enrolled in Medicare, Part A and Part B, those not yet drawing Social Security or Railroad Retirement Board benefits, you'll need to enroll with Social Security. You can visit the socialsecurity.gov or ssa.gov website or call 1-800-772-1213. Note, even though the age for Social Security retirement benefits is increasing, Medicare eligibility age is still 65. When can you sign up for Medicare? If you don't already have Medicare, there's an initial enrollment period, or IEP, which is a 7-month period for people just turning 65. There's a special enrollment period, SEP, which is an 8-month period, for example, for those people who retire post age 65. And there's a general enrollment period, or GEP, for those who fail to enroll at 65 or retirement. If you already have Medicare, to make changes to how you get your coverage, e.g., to switch between Original Medicare and Medicare Advantage, you get a yearly open enrollment period from October 15th to December 7th. The initial enrollment period, or IEP, is for people turning 65, whether they're still working or not. They must at least enroll in the free Part A. The 7-month period begins 3 months prior to the month you turn 65, the month you turn 65, and the 3 months after the month you turn 65. Coverage will begin at the earliest, the first of the month in which you turn 65. For those who enroll in the 1, 2, or 3 months after that month, the effective enrollment date will be delayed 2 to 3 months. Part A, if you have to buy it, and or for Part B. During your initial enrollment period, you can enroll or join Part A, Part B, Medicare Advantage if you already have Part A and Part B, or Part D if you have Part A and or B. There is no late enrollment penalties if you enroll during this period. You can buy a Medigap policy, but you must have Part A and Part B, but not Medicare Advantage. Medigap's guaranteed no restriction open enrollment period lasts 6 months from when you're both 65 and have Part B. Special enrollment period, most commonly used by those retiring after the age 65 initial enrollment period. There's an 8-month period after the employer group health plan ends when you can enroll in Part A if you fail to get Part A at age 65. There's no penalty unless you are lacking 10 years paid into FICA. Part B, usually there's no Part B late enrollment penalties. If you enroll during your special enrollment period, you can also enroll in MA, Medicare Advantage, but you must have Part A and Part B. Or Part D, Part A and or Part B are required. You have 6 months from the Part B effective date to buy a Medigap policy, regardless of pre-existing conditions, but you must have already enrolled in Part A and Part B. General Enrollment Period, GEP, for those who failed to enroll at age 65 or within 8 months of retirement. There's a limited 3-month period each year from January 1st to March 31st, during which you are allowed to enroll or join in Part A and Part B, but coverage is delayed until July 1st. You may have late enrollment penalties. If you enroll in Medicare during the GEP, you can, from April 1st to June 30th, also sign up for Medicare Advantage if you have Part A and Part B, and or Part D if you have Part A and or Part B. Coverage does not begin till July 1st. There's a yearly open enrollment period for people already enrolled in Parts A and B. It goes from October 15th to December 7th. This is a 7-week period where if you are already enrolled in Parts A and B, you can enroll in, disenroll, or switch MA plans or prescription drug plans, including original Medicare prescription drug plans. This is a good time to review your health and drug plan choices. The coverage for this begins the following January 1st. Medicare Advantage open enrollment period is for those already enrolled in Part A and Part B who want to switch. This begins January 1st and continues through March 31st. It's a 3-month period during which you can switch MA plans from a Medicare Advantage plan with prescription drug coverage to one that doesn't have drug coverage, or vice versa. You can drop an MA plan and return to original Medicare. If you do, you can then enroll in a Part D plan, but you won't have a guaranteed issue right for a Medicare supplement or Medigap policy, except with the guaranteed issue company such as Blue Cross. You must already be enrolled in an MA plan at any time during the first 3 months of the year to use this enrollment period. Coverage after this enrollment period begins the first month after you enroll. Part A, hospital insurance, helps cover medically necessary inpatient care in a hospital for semi-private room, meals, general nursing, drugs, and other hospital services and supplies as part of your inpatient treatment. It includes care you get in acute care hospitals, critical access hospitals, inpatient rehabilitation facilities, long-term care hospitals, psychiatric care. In inpatient psychiatric facilities, there's a lifetime 190-day limit in a freestanding psychiatric hospital. And inpatient care for qualifying clinical research study. Inpatient care in a skilled nursing facility after a related 3-day inpatient hospital stay, if you meet all the criteria. Continued hospital insurance. Part A also covers blood as an inpatient, hospice care, home health care, and inpatient care in a religious, non-medical healthcare institution. Part A, what you pay in original Medicare. If you go into a hospital for an inpatient stay lasting up to 60 days, there is a single $1,408 deductible for each benefit period. Same thing applies to a mental health inpatient stay. For skilled nursing facilities, days 1 through 20, there is no charge to the beneficiary, as long as the beneficiary has spent a minimum of 3 nights inpatient hospitalization prior to going to the skilled nursing facility. For days 21 through 100, there's a $176 coinsurance per day for each benefit period. For days 101 and beyond, all costs are borne by the beneficiary. Hospice care, there is no charge for hospice care to the beneficiary. Blood, if a hospital gets the blood from a blood bank at no charge, you have no charge. The decision you need to make: do I need to sign up for Part A? Part A is free for most people. It is prepaid by you or your spouse through FICA. You can pay for it if you have to, if your work history isn't sufficient. Recent immigrants find themselves in this position sometimes. If you have to pay, there may be a penalty if you delay beyond age 65. Talk to your employer benefits administrator if you or your spouse are actively working and covered by an employer plan. It may require you obtain Part A. Part B medical insurance covers doctor services that are medically necessary, and all outpatient medical and surgical services and supplies, clinical lab tests, durable medical equipment like walkers, wheelchairs, oxygen, diabetic testing equipment and supplies, preventive services like flu shots and a yearly wellness visit. See the next slide. Home health care, medically necessary outpatient physical and occupational therapy, and speech language pathology services, and outpatient mental health care services. Preventive services. This is a long list of preventive services that Medicare covers. What is not covered by Medicare Part A and Part B? Some of the items and services that Part A and Part B don't cover include most dental care, eye examinations related to prescribing glasses, dentures, cosmetic surgery, massage therapy, routine physical exams. However, you do get one free Welcome to Medicare physical exam during the first 12 months enrolled in Part B. Acupuncture or other types of acupuncture like dry needling for any condition other than chronic low back pain, which now is covered by Medicare Part B. Hearing aids and exams for fitting them are not covered, nor are long-term care, concierge care, also called concierge medicine, retainer-based medicine, boutique medicine, platinum practice, or direct care. These may be covered if you have other coverage like Medicaid or an MA plan that covers these services. What you pay 2020 for Part B premiums. The monthly premium for 2020, the standard premium is $144.60. The Part B premium is means tested. Singles with gross annual or MAGI income over $87,000 pay a premium of $202.40 per month. If a single person's income exceeds $109,000, the premium goes up even more. Couples with a gross annual income, or MAGI, over $174,000 pay $202.40 per month for each spouse, assuming both are in Part B. If a couple's income exceeds $218,000, the premium goes up even more. If the MAGI later falls on your filed 1040, premiums will be adjusted. Some people who get Social Security benefits pay less than $144.60. Those at about 137% of poverty level income or less with low assets can get Part B premium waived by the Medicare Savings Program, which will be discussed near the end of this presentation. Part B, what you pay in original Medicare in 2020. The yearly deductible is $198. After a beneficiary pays out of pocket the first $198 of Part B combined charges, then the annual deductible is met. Coinsurance for Part B service, which is normally 20%, for most covered services like doctor services, testing, labs, etc., and some preventative service, if a provider accepts Medicare assignment, as most do. A very small percentage of providers, though accepting Medicare, don't accept Medicare assignment. They are allowed to charge 15% more than Medicare normally allows. The coinsurance for most preventive service is zero. The 20% coinsurance for outpatient mental health services and copayments for hospital outpatient services are also the responsibility of the beneficiary. Only grandfathered beneficiaries, those over age 65 before January 1st, 2020, who may be enrolled in supplement plans C or F, are exempt from yearly $198 Part B deductible. Decision, should I keep or sign up for Part B? Consider most people pay a monthly premium of $144.60. It is usually deducted from Social Security or Railroad Retirement Board benefits. The premium depends on income. It's higher if for a single person it's above $87,000, or for a couple it's above $174,000. Once you've enrolled in Part A and Part B, you are covered for at least 80% of all Part B charges, even more for most Part A charges, even if you do nothing else, such as get a Medigap plan or switch to a free or low-cost Medicare Advantage plan. You may have employer coverage and only need the free Part A. Contact your benefits administrator to understand the impact to your employer plan. Often those in employer group health plans, GHP, don't have to enroll in Part B. But if you don't have other medical coverage, declining Part B will mean you don't have full coverage and will likely have to pay a penalty when you do get Part B. Sometimes you must have Part B. See the next slide. When you must have Part A and Part B, if you want to buy a Medicare supplement insurance or Medigap policy, if you want to join a Medicare Advantage plan, if you're eligible for TRICARE for Life or Civilian Health and Medical Program of the Department of Veterans Affairs, and if your employer coverage requires you to have it. That means your employer probably has less than 20 employees. Talk to your employer or union benefits administrator. Note, Veterans Affairs benefits are separate from Medicare. With VA benefits, you may choose to not enroll in Part B, but you pay a penalty if you don't sign up for Part B during your initial enrollment period and enroll later. Visit va.gov. If you have VA coverage, you won't be eligible to enroll in Part B using the special enrollment period. Medigap policies. They are sold by private insurance companies licensed and regulated by Medicare and the Department on Aging. They fill gaps in original Medicare coverage for deductibles, coinsurance, and copayments. All plans with the same letter designation, for example, G or N, have exactly the same coverage, but premium costs vary widely between companies. The most common Medigap plans sold now are G plans and N plans. The G plan covers all the gaps in Part A, the flat per hospital stay charge of $1,408 in skilled nursing facility day 21 through 100, $176 per day deductible. And in Part B, the 20% copay, with the exception of the first $198 per year in Part B charges, that is doctors, lab tests, x-rays, etc., that a person incurs per calendar year. This is called the Part B deductible. The N plan is very similar to a G plan with essentially the same coverage, except a copay of no more than $20 per office visit is required for any doctor specialist visit and $50 per emergency room visit. But all other Part B charges, tests, therapy, surgery, etc., are fully covered. On average, an N plan costs about $250 to $500 per year less than a G plan. For a 65-year-old person in the six-county Chicagoland area, the 10 least expensive G plans average from about $1,450 per year to $1,600 per year, rising to $2,500 to $2,700 per year at age 85. The 10 least expensive N plans average from about $1,200 a year to $1,300 a year, rising to $2,000 to $2,500 per year at age 85. Decision: do I need a Medigap policy? Consider that Medigap supplement plans are only available for those in original Medicare. All Medigap plans are approved by Medicare and the Illinois Department on Aging. All plans are strictly regulated by Medicare, which has the final say on what must be covered and the exact amount the Medigap company is responsible to pay for every procedure Medicare has approved. Do you have other supplemental coverage, like from an employer? If so, you might not need Medigap. Can you afford Medicare deductibles and copayments on your own? When is the best time to buy a Medigap policy? Your Medigap open enrollment period begins the month you're 65 or older and enrolled in Part B. Medigap open enrollment lasts 6 months in Illinois from enrollment date in Part B. Should any insurer drop coverage in your state, Medicare guarantees you can then go to any other insurer as if you were back in your initial enrollment period, regardless of your health. During your 6-month Medigap open enrollment period, companies cannot refuse to sell you any Medigap policy they offer, nor can they make you wait for coverage or charge more because of a past or present health problem. If you delay, there may be restrictions unless you have a guaranteed issue right. You can also buy a Medigap policy at any time after the open enrollment period if a company agrees to sell you one. Currently, Blue Cross is the only guaranteed issue insurer in Illinois. How to buy a Medigap policy. Decide which Medigap plan, A through N, has the benefits you need, costs you could afford. SHIP recommends you arrange a free telephonic appointment or in person after COVID with SHIP at the Arlington Heights Senior Center on Friday mornings. During Part D open season, October 15th to December 7th, SHIP is open Tuesday and Friday mornings. You'll receive an Illinois Department on Aging Medicare Supplement Premium Comparison Guide listing all Medigap plans available, pricing, 800 phone numbers, and web page link. The Medicare Supplement Premium Comparison Guide can be downloaded by anyone at the below web address. You can compare plans online or by calling the 800 number for the plan listed in the guide. Once you choose a Medigap insurer and plan and apply for the policy, coverage can start as soon as your effective date of enrollment in Part A and Part B. Prescription drug coverage, Part D, an optional benefit available to all people with Medicare. It's run by private companies that contract with Medicare. It's provided through either Medicare Prescription Drug Plans, PDPs, which works with Original Medicare, or Medicare Advantage Prescription Drug Plans, MAPDs, or some other Medicare health plan. How does Part D work? Part D is optional. You can choose a plan and choose online or by phone. If taking no medications to avoid later penalty, it is recommended to find the least expensive plan. You may pay a lifetime penalty if you join late. Plans have formularies. Each Part D insurer has their own formulary or list of covered drugs. Formularies must include a range of drugs in each category because of Medicare requirements. And the formularies are subject to change. You will be notified by the company if your formulary is changed after you enroll. Your out-of-pocket cost may be less if you use a preferred pharmacy. If you have limited income and resources, there's extra help to pay Part D costs to be discussed near the end of this presentation. Medicare drug plan costs, what you pay in 2020, and income-related monthly adjustment amount, or IRMA, for 2020. Costs vary by Part D drug plan. For this year, most plans sold average between $13 and $35 per month. Most people will pay a monthly premium, which varies by plan and for high-income beneficiaries, also by income. Singles with an annual gross or MAGI income over $87,000 pay $12.20 per month extra premium. Couples with gross income over $174,000 each pay $12.20 monthly extra premium. Note, the higher income penalty will be adjusted downward if your filed IRS 1040 MAGI drops. A yearly deductible, if applicable, in 2020, the deductible maximum is $430. Insurers are allowed to charge. Drug co-payments, pre-donut hole, during the full coverage. You often don't pay more than 10% or even less of the full price of the drug. For example, Eliquis lists for about $400 per month, but costs you about $40 a month. But if in the coverage gap, that means you've reached the donut hole, you pay 25% of the full cost of drugs. This gap begins when the combined insurance portion and your portion of drug costs reaches $4,020 for the year. Catastrophic coverage. If you spend $6,350 out of your own pocket for drugs in 2020, the coverage gap or donut hole ends automatically. You then pay a maximum of 5% of the full cost of your prescription drugs for the rest of the calendar year. Part D late enrollment penalty. You may have to pay more if you wait to enroll. Exceptions if you have creditable drug coverage or extra help for low-income persons. Details at the end of this presentation. You'll pay the penalty for as long as you have coverage. The penalty is 1% for each full month eligible and without creditable prescription drug coverage. Multiply 1% times the base beneficiary premium currently $32.74, times the number of months that you haven't had coverage. Example, for a 5-year delay, which is 60 months, times 1% of $32.74 equals $19.65 monthly penalty you would be required to pay on top of the regular drug company premium for the rest of your life. The base beneficiary premium amount changes every year. Who can join Part D? You must have Part A and or Part B to join a Medicare prescription drug plan. You must have Part A and Part B to join an MA prescription drug plan. You must live in the plan's service area. You can't be incarcerated. You can't be unlawfully present in the U.S. and you can't live outside the United States. When can I enroll in a Part D plan? During your 7-month initial enrollment period, or IEP, coverage begins the first of the month following your enrollment in Part D. During the yearly open enrollment period, or OEP, from October 15th to December 7th each year, coverage begins January 1st, or if you're still in an initial enrollment period, it begins on the first day of the following month. If you get Part B for the first time during a general enrollment period, GEP, you can join a Part D plan from April 1 to June 30, but without coverage until July 1st. You may be able to join at other times, such as if you're in a Medicare Advantage plan on January 1, your Medicare Advantage open enrollment period is from January 1 to March 31st each year. If you're new to Medicare and enrolled in an MA plan during your initial enrollment period, you can make a change within the first 3 months you have Medicare. Or if you're in a special enrollment period, if you qualify. Choosing a Part D plan, how do I enroll? To ensure you're getting the most cost-effective plan, it's best to call the SHIP office at the Senior Center and arrange a telephone or in-person, when allowed, appointment so your medications, doses, and preferred pharmacies can be entered into Medicare's Drug Plan Finder application tool. The online application at medicare.gov will quickly find the most cost-effective plan based on the drugs you take, the premium, and any deductibles, and find which pharmacy has the lowest prices for your plan. You can compare the plans by computer or phone. Use the Medicare Plan Finder at medicare.gov/plan-compare. Or you can call 1-800-MEDICARE, that's 1-800-633-4227, or contact your SHIP office for help comparing plans. To join a Part D plan, you can also enroll at medicare.gov/plan-compare, or call the 800 Medicare number and enroll on the plan, or enroll on the plan's website, or call the plan. You can complete a paper enrollment form. The plan will notify you whether it's accepted or has denied your application. You can't be denied based on health condition or the drugs you take. Decision: should I enroll in a Part D plan? Consider if you have creditable prescription drug coverage, such as from an employer in a group health plan. Will it pay at least as much as standard Medicare drug coverage would? Will you or your spouse or dependents lose your health coverage if you join a Medicare drug plan? How do your out-of-pocket drug costs compare to out-of-pocket drug costs with a Medicare drug plan? How will your costs change if you get extra help with your Medicare drug plan costs? If you don't have creditable prescription drug coverage, later enrollment may mean you pay a penalty if or when you finally enroll. If you go 63 or more days in a row without creditable coverage, Medicare Advantage, MA plans, or Part C. An MA plan is another way to get your Medicare coverage, sometimes called Part C, offered by Medicare-approved private companies that must follow rules set by Medicare. If you join an MA plan, you'll still have Medicare, but you'll get your Part A hospital insurance and Part B medical insurance coverage from the MA plan, not original Medicare. In most MA plans, you'll also get full drug coverage without any extra premium from the plan. You'll need to use healthcare providers who participate in the plan's network. Some plans offer out-of-network coverage. How Medicare Advantage plans work. In an MA plan, you're still in Medicare with all the rights and protections. Still get services covered by Part A and Part B. You may choose a plan that includes prescription drug coverage. You can be charged different out-of-pocket costs depending on the insurer. You can't be charged more than original Medicare for certain services like chemotherapy, dialysis, and skilled nursing facility care. You may choose a plan with extra benefits like vision, dental, or fitness and wellness benefits. And you have a yearly limit on your out-of-pocket costs. How Medicare Advantage works continued. Each plan has a service area in which its enrollees must live. You or a provider for you can request to see if an item or service will be covered by the plan in advance, called an organization determination. Contact your plan for more information. Medicare pays a fixed amount for your coverage each month to companies offering MA plans. You pay fixed copays, for example, from $0 to $10 for a general practitioner visit, or $30 for a specialist, with most tests covered. An average of $250 per day inpatient hospitalization for only the first 7 or so days. Thereafter, that fee is waived. An emergency room average fee of $150. Certain expensive tests such as CT or MRI, the copay may average about $100. Skilled nursing care, first 20 days, free or only a nominal fee, such as $10 a day. But for days 21 through 100 requires a copay similar to the copay those in original Medicare pay for those without Medigap coverage, i.e. $176 a day. However, unlike an original Medicare, Medicare Advantage has a yearly out-of-pocket maximum which averages from about $2,800 to $4,500. Each plan has different rules and can change yearly for how you get services. Hospice care is covered, but by original Medicare, not the MA plan. When can I enroll in a Medicare Advantage plan? The initial enrollment period, or IEP, begins 3 months before the month you turn 65, includes the month you turn 65, and ends 3 months after the month you turn 65. The general enrollment period, or GEP, if you have Part A and enroll in Part B during a GEP, you can enroll in an MA plan from April 1st to June 30th, with coverage starting July 1st. The special enrollment period, or SEP, in certain circumstances, like if you retire after the age 65 initial enrollment period, then within 8 months first enroll in Part A and Part B. If you move out of your plan's service area, if you have or lose Medicaid or extra help, if you move in or out of an institution like a nursing home. Finally, the 5-star special enrollment period, from December 8th to the following November 30th each year. You can switch to an MA plan or Medicare cost plan that has 5 stars for its overall star rating. When can I enroll in a Medicare Advantage plan continued? Yearly, an open enrollment period exists from October 15th to December 7th. Medicare Advantage open enrollment period has a one-time change each year from January 1 to March 31st. The coverage begins the first of the month afterwards. You must already be enrolled in an MA plan at any time during the first 3 months of the year. To switch to another MA plan with or without drug coverage. To drop your MA plan and return to original Medicare, you can also join a standalone Part D Medicare prescription drug plan. If you're new to Medicare and you're enrolled in a Medicare Advantage plan during your initial enrollment period, you can make a change within the first 3 months you have Medicare. Note, if you drop a Medicare supplement insurance policy to join an MA plan, you might not be able to get that Medigap plan back later if you return to original Medicare. How do I enroll in Medicare Advantage plan? Use the Medicare Plan Finder, medicare.gov/plan-compare. If you have access to a Medicare and You booklet given out each year to each household with a Medicare beneficiary, also available at the SHIP office at the Arlington Heights Senior Center and online, you can review health plans, the last section of the booklet, to see MA plans available in your geographic area. Visit the plan's website to see if you can join online. You could also fill out a paper enrollment form. You can contact the plan to get an enrollment form, fill it out, and return it to the plan. All plans must offer this option. You can call the plan directly that you want to join and get your plan's contact information from the Plan Finder. Or finally, you can call 1-800-MEDICARE. That is 1-800-633-4227. Decision: should I join an MA plan? Consider: you must have Part A and Part B to join. Most offer comprehensive coverage, including Part D drug coverage. Some plans may require you to use a network, doctor, or provider, etc. You may need a referral to see a specialist. You must pay the Part B premium, just like those in original Medicare, of $144.60 per month, and the monthly Medicare Advantage plan premium, if there is any. Many plans in Illinois are premium free. You can only join or leave a plan during certain periods. And remember, the Medicare Advantage does not work with Medigap policies, which are only for original Medicare. Medicare in the Marketplace, or Affordable Care Act. It's against the law for someone who knows you have Medicare to sell you a marketplace plan, even if you only have Part A or Part B, except through the Small Business SHOP program, if you're an active worker or a dependent of an active worker. You can keep a marketplace plan after your Medicare coverage begins, but once your Part A coverage starts, you'll no longer be eligible for any premium tax credits or other cost savings you may be getting from your Marketplace or Affordable Care Act plan. You'll have to pay the full price for the Marketplace plan. Sign up for Medicare during your 7-month initial enrollment period. If you wait, you may have to pay a late enrollment penalty for as long as you have Medicare. Medicare for people with disabilities in the Marketplace. You may qualify for Medicare based on a disability. You must be getting Social Security Disability Insurance, SSDI, benefits for 24 months, except for certain disabilities. On the 25th month, you're automatically enrolled in Part A and Part B. If you're getting SSDI, you can get a Marketplace plan to cover you during your 24-month Medicare waiting period. You may qualify for premium tax credits and reduced cost sharing until your Medicare coverage starts. Choosing Marketplace coverage instead of Medicare. You can choose Marketplace coverage instead of Medicare if you are paying a premium for Part A because of a lack of 10 years FICA payment. You can drop your Part A and Part B coverage and get a Marketplace plan instead. Or if you only have Part B and have to pay a premium for Part A, you can drop Part B and get a Marketplace plan instead. Or if you're eligible for Medicare but haven't enrolled in it because you would have to pay a premium for Part A, or have a medical condition that qualifies you for Medicare, like end-stage renal disease, but haven't applied for Medicare coverage, or are in your 24-month disability waiting period. There are 3 programs that offer help for people with limited income and resources. What is Extra Help? Extra Help is a program to help people pay for Medicare prescription drug costs in Part D. It's also called the Low Income Subsidy, or LIS. If you have a low gross income and resources, an upcoming slide has the numbers, you can pay no premiums or deductible and only small or no co-payments. If you have slightly higher income and resources, you can pay a reduced deductible and a little more out of pocket. The coverage gap, or donut hole, and late enrollment penalty are waived in Extra Help. A special enrollment period, or SEP, for those in Extra Help allows you to change your Medicare drug plan once per quarter in the first 3 quarters of the year. And if you want to change plans in the 4th quarter, you must use the open enrollment period. Qualifying for Extra Help. You automatically qualify for Extra Help with no need to apply if you get full Medicaid coverage, if you have Supplemental Security Income, SSI, or if you have help from Medicaid paying your Medicare premiums, that is the Medicare Savings Program, sometimes called being a partial dual enrollee. All others must apply. How to apply for Extra Help for prescription drugs? Contact Catholic Charities through the Arlington Heights Senior Center, 847-253-5532. You can go online at socialsecurity.gov/benefits/Medicare/prescription help. Or you can call Social Security at 1-800-772-1213 and ask for an application for help with Medicare prescription drug plan costs. Finally, you can contact your state medical assistance or Medicaid office. As I said, there are 3 programs for help with those with limited income and resources. The first, Extra Help, which I already spoke about, gives you a free Part D drug plan and low or no cost name brand and generic drugs. The maximum income for this program for a single person is $1,595 per month. The maximum assets, such as CDs, savings accounts, investments, etc., is $14,610, except for car and home, which is not included under assets. The maximum income for a couple for Extra Help is $2,155 a month in gross income. The maximum assets for a couple is $29,160, except for a car and home, which are not included. To apply for Extra Help, again, call Catholic Charities through the Arlington Heights Senior Center, 847-253-5532. The second program is called the Medicare Savings Programs, or MSP. This pays your Medicare Part B premiums of $144.60 per month. Help from your state in paying Medicare costs may also help with deductibles, coinsurance, and co-payments depending on income and assets. Again, savings, CDs, IRA, etc., but accepting a car and a home. The maximum income for the Medicare Savings Program for a single person is $1,456 per month, and maximum assets for a single person, $7,860, again, except car and home. Maximum income for a couple for the Medicare Savings Program is $1,960 per month. Maximum assets, $11,800, again, accepting a car, and a home. To apply for the Medicare Savings Program, call Catholic Charities through the Arlington Heights Senior Center at 847-253-5532. Medicaid. Those at or near poverty level income may be eligible for Medicaid. It can work with Medicare. Again, a dual eligible. To apply, call Catholic Charities through the Arlington Heights Senior Center, 847-253-5532. What is Medicaid and qualifying for Medicaid? Medicaid is a joint federal and state program. It helps pay health care costs for people with limited income and resources. Some people qualify for Medicare and Medicaid. As I mentioned previously, they're called dual eligibles. Medicaid may cover services that Medicare may not or may partially cover, like nursing home care, personal care, and home and community-based services. Medicaid has covered 71.2 million people in 2019. Medicaid programs vary from state to state. Each have different income and resource requirements. To apply, call Catholic Charities through the Arlington Heights Senior Center at 847-253-5532 or call your state medical assistance Medicaid office for more information or to see if you qualify. You can also visit medicare.gov/contacts or call 1-800-MEDICARE. That's 1-800-633-4227. In some states, you may need to be enrolled in Medicare if eligible.